welcome to our Monday Minute. Today, we're going to address a very important topic. As we discussed with the Monday Minute regarding the home health proposed rule, we discussed that there will be changes to the 2026 value-based purchasing program if the proposed rule is finalized as proposed. In the changes to the value-based purchasing model, there is going to be a new measure titled the Medicare Spending Per Beneficiary Post-Acute Care Measure. Today, we are joined by Jennifer Osburn, who is one of our consultants at Healthcare Provider Solutions. She is going to be taking us through the key elements of the Medicare Spending Per Beneficiary calculation. She will also be joining us on the HPS Alliance webinar to give you even more detail and examples on how the Medicare beneficiary calculation is made.
So we see the Medicare Spending per Beneficiary measure. It's intended really to nudge agencies to increase coordination of care for patients that are cared for in a home health agency in a patient-centered care model, really. So by calculating cost, it holds our agencies responsible or accountable for resource use during the patient's care from the agency. The Medicare Spending per Beneficiary measure is an Impact Act measure. It's been part of Home Health Quality Reporting Program since 2017, but Medicare Spending per Beneficiary is also used in other post-acute care settings like IRFs, LTACs, and SNFs. So this is a cost resource use measure. It reports resource utilization, which is the cost to Medicare for services performed by these post-acute care providers per beneficiary. Now this measure compares a provider, in other words our home health agencies, Medicare spending per beneficiary by stay or episode to a national median Medicare spending per beneficiary by stay or episode in the same performance period. Now one thing you'll notice that's a little bit different. For home health, Medicare spending per beneficiary is measured in an episode. In the other settings, it's measured by a stay. So Medicare basically says if this measure is finalized as proposed, it's going to use 2 years of data, as we just said. It is a 2-year measure, and each performance year going forward would consist of 1 year of data that does not overlap with data from the prior performance year, and that would give sufficient opportunity to capture quality improvement over time. So how is the measure calculated? Well, it's a several-step process, but overall, the numerator is the Medicare spending per beneficiary post-acute care home health amount, which is the average risk-adjusted episode spending across all episodes for the home health provider. That is then multiplied by the national average spending level for all home health providers. To calculate this Medicare spending per beneficiary amount for each post-acute care provider, they calculate the average of the ratio of the standardized episode spending over the expected episode spending, and then they multiply that by the average episode spending level across all home health providers. And we're going to break that down and give some examples in just a minute. The denominator is the episode-weighted national median of Medicare spending per beneficiary amounts across all home health providers. So first, let's understand what they're talking about by episodes. They're looking at all Medicare Part A and Part B services within an episode window, which we're going to define in just a moment. That episode window is triggered by the first day of a home health claim, and that first day marks the first day of the treatment period. There are 3 types of episodes for home health for this post-acute care measure. The standard episode, which is triggered by a home health claim to which there's neither a LUPA claim or a PEP adjustment for that claim. LUPAs are triggered, a LUPA episode is triggered by a claim to which a LUPA episode applies. And then a partial episode payment, or PEP, is triggered by a claim to which a PEP adjustment applies. Now, A PEP is a prorated adjustment for shortened periods as a result of patient being discharged and readmitted to the same agency or to another agency before 60 days break has happened in between that admission and discharge. If you should have a claim that is both PEP eligible and a LUPA adjustment applies, in that case that's going to be assigned to a PEP episode type for this measure calculation. Now, Medicare spending per beneficiary agency episodes are only compared to episodes of the same type, meaning LUPA episodes are compared to LUPA episodes, PEP episodes are compared to PEP episodes. So they don't take all of them and lump them together, in other words. They are compared by episodes of the same type. So this episode window here, when we think about those definitions we talked about a minute ago, the episode window here is represented by the parentheses or the brackets that you see. And then you'll notice at the top you've got attributed providers episode, and that's the umbrella under which the treatment period and the associated services kind of all live together, right? You'll notice the arrow. The arrow represents the first day of service on the claim. The striped triangles represent associated treatments or services, whereas the black triangles would represent the home health services that we are providing. Medicare spending per beneficiary is calculated for services billed by the agency during the treatment period, as well as for associated services during that associated services period. For example, if your patient goes in and has a hospital stay while they're on services with your agency, then those costs are attributed to your spending.
Thank you so much for joining us today. We are very appreciative of your attention with the HPS Alliance and our Monday Minutes. If there's anything we can do to assist you with value-based purchasing, please don't hesitate to let us know. Do note that the 2024 annual reports with your adjustments for 2026 payments were just issued a couple of weeks ago, and we will be diving deeper into those in our upcoming Alliance webinar. Thank you so much and have a fabulous week.